Fever in children, first of all, it's not a disease, is that correct?
Fever? No, it's a
It's
sign
not a
or a
disease,
symptom.
and many reasons for it. So bringing it down doesn't make the kid cured of anything. All it did is make the kid a little bit more comfortable. And I think one of the problems we have today, people think if my kid had 104 and I got the fever down to normal, the kid is now cured, and that isn't true, is it?
No.
So you really have to look at the cause of the fever. And if you saw a kid in a room that had a high temperature, again, what would make you, from the glance, say, this kid may not have a big problem, but a kid that maybe has something very serious, what would you be looking at the kid? What would the observations you make from your experience?
Well, yeah, often you can decide whether a kid is really sick from the door, and I actually tell the residents that a lot. Is he related? Is he looking at his parents? Is he looking at you? If he's a young kid under 18 months or 2 years, is he fearful when you walk in the room or anxious? If he's not relating, if he doesn't notice you come in the room, if he's not attached to his parent, he may be sicker than you'd like to have him be. The other thing is whether he's active, playful, happy. Kids with sometimes with 103, 104 will be that way, and that's certainly a good sign that it's less likely that something serious is happening.
And actually the fever, in a way, is not a terrible thing. It's your immune system doing its job.
Immune system doing its job, and I think there's some evidence in some studies a few years ago where fever above 101, under 101.5 is actually found to be beneficial in terms of eliminating the virus or the bacterial process that was causing it.
So again, Mother Nature is doing its job, but if it's over 102, most doctors want to get it down to make the kid a little bit more comfortable. But if the kid's playful and it's 101, you don't have to reach for that Tylenol or that Motrin or Advil bottle.
Exactly, and that's what we do. I mean, if a child is 101 but uncomfortable, certainly we can give him something. But if he's happy, then we don't treat the fever until it's approaching 102.
I mean, Advil, Motrin, and Tylenol are probably safe, used correctly. But there was some indication in an Israeli study about using Motrin and Advil. It decreases the kid's white blood cell counts in that study. And a significant number of patients were affected. And it's into the white blood cells, not even the antibiotic that really does the killing and its final job. The antibiotics get the white blood cells in position to do the final kill. Is that correct?
Yeah, right. It's not the antibiotics. That is, it's just preparing the bacteria to be killed by the white cells. So those are important. And I think Tylenol's been implicated in some elevated liver function tests. So too much Tylenol can.
So if we use things appropriately, minimize overuse, we're probably okay. And if you do use any medicine, you have to realize something. You still don't know what's wrong with the kid. If you think the kid is seriously ill, that must be assessed right away. And what would make you think this kid is sicker than another kid that came into your office? What would be the signs the kid had a fever? They said, oh, we got to see the doctor right away. What would be the things you'd be looking for?
Coughing, any kind of distress. Again, that lack of attachment, lack of relatedness.
Photophobia, irritability.
Irritability, can't stay in a room with bright lights. Yeah.
Okay, and also the young children under 2 to 3 months, fever is a red flag to almost every pediatrician. Is that correct?
That is, because you can have subtle infections that may not be evident, like a cold or a cough, such as a urinary tract infection or even meningitis.
And you really shouldn't treat fever with antibiotics. You treat a bacterial infection, not viral illnesses. Is that correct?
Yeah, bacteria respond to antibiotics, but viruses don't. In fact, giving antibiotics where you clearly or you're presumed to have a viral infection really won't help at all and might make you more susceptible to a resistant bacterial infection later on.
And also make the chance that antibiotics become more resistant inappropriately. Is that correct?
Yes.